Every day this month, President Obama is working on his make-or-break healthcare push, the latest step talking up reform to faith-based groups and religious leaders. In a conference call with at least 140,000 people, the president called reform, quote, a core ethical and moral obligation. And he asked those listening to help spread the word, if you will.
I know there's been a lot of misinformation in this debate, and there are some folks out there who are, frankly, bearing false witness. I need you to spread the facts and speak the truth.
For more, let's bring in Reverend Jim Wallis. He is a member of the President's Advisory Council on Faith-Based Partnerships, and Tony Perkins, who's the president of the Family Research Council. And Tony, let's start with you. The president, you heard him there, accused some people of bearing false witness on health care reform. You know, talk of these so-called death panels, this idea, too, that illegal immigrants would be given health care under the new plans. There's no question there's a lot of disinformation out there in addition to misinformation. What do you make of the president's appeal for people to tell the truth about what's going on with health care?
Well, I do think the truth needs to be told, and I think that in this discussion that we're having nationally, everyone is entitled to their opinion on whether or not the government should take over health care. But what we're not entitled to is our own set of facts. And we have to realize that it's not the president's promises that will become law, but rather it's the bill itself. And if we want to have a discussion, it needs to be focused on the bill and what's contained in the bill. And there are some serious concerns over where this bill would lead us. And there's clear indications that it would lead us to an expansion of taxpayer-funded abortion in this country, that it does not protect, as it currently stands, the conscience rights of healthcare workers. And there is concern over the end-of-life counseling that's in the bill, especially in states like Oregon and Washington State, where physician-assisted suicide is present.
Okay, well, let's take on a couple of those issues. And Jim Wallis, maybe you can give us your reading of the facts in the bill. This idea that it would, as Tony said, be an expansion of taxpayer-funded abortion. Is that anywhere in the bill?
Well, we just heard some more of those falsehoods, I'm afraid. Look, in the shouting, in the misinformation, in the fear out there, we're losing the moral core of this debate, which is a lot of people are hurting in this broken healthcare system. 47 million people are not being covered, and many more can't get what they need and can't afford to have good health.
Jim,
For example, on the abortion question,
Jim, I'm sorry. Yeah, okay, go ahead on the abortion question.
On the abortion question, there's a broad consensus in the faith community that health care reform should not change. Federal rules about abortion, federal funding of abortion should not happen in health care. In fact, abortion should not sidetrack the health care debate, the health care reform that we need. So we agree on that, and I'll be working hard to make sure two things are here. One is that all of God's children get covered by health care reform, and two, that abortion rules, federal funding of abortion doesn't change in health care. I agree to that. So let's have a broad-based conversation to fix a broken system, and while we respect conscience at the same time. Conscience rules are important. No federal funding of abortion is important. I agree with that. But let's focus on the real issue here. A lot of people are hurting in this broken system. Okay. We have to fix a broken system.
I think there's no question a lot of people are hurting here. But, Jim, I asked you specifically, is there any provision for federal funding of abortion in any of these health care plans? And you didn't quite get to the core of that question. So let me ask.
Oh, well, let me say it again. Last night, President Obama agreed with our conviction that the rules shouldn't change.
Okay, so you said the rules shouldn't change, but Tony, do you read anything in any of these bills that says, yes, federal funds either will be or could be used to fund abortion?
Look, John, in the bill, if you do a word search of the 1,000-page bill on tonsillectomy, you won't find that. Hysterectomy, you won't find that. It's not the word abortion. And Jim says that the rules prohibiting federal funding of abortion. Let me talk about that. That's the Hyde Amendment, which is an annual appropriations rider, and it's only on one appropriations bill. The government has several appropriations bills which would not cover this present health care bill. So first off, the Hyde Amendment is an annual measure that wouldn't apply to this, and secondly, it only requires a simple majority vote to reenact every year. This is clear. It's not the president's promises, it's what's in this bill. And there's no question that this would lead, whether you call it taxpayer-funded abortion or citizens paying government premiums to a government system, it's going to expand abortion. This can be solved very easy.
And
12 amendments.
If I could just point out, too, there's one other point of concern here when it comes to abortion, and Jim, perhaps you can address this, and that is that the bills, at least one of the bills, calls for there to be, in these so-called exchanges, one private plan that does provide abortion services. Now, supposedly there are protections that federal funds will not be used to fund those premiums, but how can you be guaranteed that somebody who's low income won't receive a government subsidy that they could use to buy that plan? I think that's an argument that some people are making here.
Well, first of all, we've got a long way to go here. There's a House bill. We have a long way to go here in the process. So what we have to do is clearly outline our principles. And the principles, last night on this call with 140,000 people, our principles were that we need accessible, affordable, secure health care for all of God's children.
Right.
We also said that we don't want the abortion rules to change. So we'll be looking, John, at all those questions, working hard to make sure that our principles are intact, that our conscience is intact.
Jim, we could take that. We could take that off the table right now. A dozen amendments were offered in both the House and the Senate to make it very clear that taxpayer-funded abortion would be prohibited. And we wouldn't have this discussion. Then we could focus on what I do agree with you on, and that is every American should have access to affordable health care. But we disagree over the method, but we could have that discussion if we would take
Tony,
these contentious issues off the table.
Let's agree right here on CNN this morning. Tony, I will support your effort to make sure that abortion is taken off the table in this debate. I'm for that. I'll work hard for that. Let's work together on that. And then you support our moral principle that all Americans should be covered by health care, secure, affordable, accessible health care. Let's work together and make sure both of those things, in fact, are a part of comprehensive health care reform, because the system is broken and we have to fix it. And don't let abortion derail that effort.
Well,
please.
ask the president then to take it off the table and accept these amendments, and then we can have a discussion on how we fix health care in this country. And I'll be glad to work with you on that, because we agree.
I think the
we
president
need to fix health care in this country.
All right,
let's do it together.
Perhaps we have, in this short amount of time, brought the two sides a little closer together than they were. Gentlemen, we look forward to you two having a conversation about all of this. Reverend Jim Wallis, Tony Perkins, good to have you on this morning. Thanks so much.
Thanks,
Thank
John.
you.